Did you have intuitions during your pregnancy, like something kept on telling you that most likely this pregnancy is not a single pregnancy and probably you are carrying twins? Welcome back, and today's video I want to talk about the most obvious signs of twin pregnancy during the first trimester. Actually, every pregnancy is different, but again with twin pregnancy there are so many complications or so many obvious signs that will lead you to know that you are carrying more than one baby just before you confirm with an ultrasound. Sixth on the list, we have early fetal movements. In single pregnancy, movements can be felt from week 18 onwards. Actually, for a prima gravida, that is a first-time mom, the movements will be felt from week 18, but on subsequent pregnancy, mostly movements are always felt from week 16 onwards. But again, in twin pregnancy, you'll feel the movements quite early as 8 weeks, yeah. Extreme morning sickness. Almost every woman experiences morning sickness during their pregnancy. But again, during twin pregnancy, it is always exaggerated. It sets in early and can prolong even past 3 months or even throughout the pregnancy. Again, it's much extreme and can even lead to what we call hyperemesis gravidarum due to excessive vomiting. Extreme fatigue. Actually, during pregnancy, you can feel that level of tiredness. You don't want to do anything, you are always tired. But again, in twin pregnancy, it's much extreme or it is exaggerated. You are always tired, always in bed, not feeling like doing things, and most of the time these people always sleep. If this is you during pregnancy, then most likely suspect that you have twins. Remember, the HCG are extremely high, and this is what leads to this high level of tiredness. And again, during twin pregnancy, there is high chances of getting anemic, low blood level, because your body is already supporting more than one baby. So once you are anemic, the obvious mostly symptoms are easily getting tired. Intense breast pain. Changes in breast is one of the early signs of pregnancy, and it always occurs due to the levels of HCG in your blood. Remember, in twin pregnancy, the HCG are always high, the levels of HCG are high, so any changes in the breast will be extreme. The breast becomes extremely bigger, very, very sensitive. There is that, they're just intensively painful and all that. If you experience this compared to your previous pregnancy, maybe where you didn't really experience such an intense breast pain or sensitive, then most likely it's a time that you need to confirm with an ultrasound. Maternal intuitions. As a mother of twins, before I even did an ultrasound to confirm that I had twins, I first felt like this pregnancy was not like the previous one, maybe because I wasn't pregnant for the first time, but I felt like this kind of pregnancy, whatever I was carrying, was more than one baby. I had that feeling that this is not a singleton pregnancy. Yeah, so there is that indescribable feeling that a mother always has when she is carrying twins. You'll feel like this kind of pregnancy, by the time you will be going to do an ultrasound, you'll just be going there to confirm. There is that instinct that keeps on telling you that this pregnancy is actually more than one baby. And so if you are thinking that you are carrying twins, then honey, maybe you are carrying twins. It is something that cannot be really explained, but there is that feeling, there is that instinct that is there. Top of the list, we have the high HCG hormone. There is certain level of HCG hormone that is required in a singleton pregnancy, and if it is past this kind of level, then most likely they'll suspect a twin pregnancy. The HCG hormone is the hormone that is always excreted in urine, and it is what you detect while doing the home pregnancy test. The blue or even the pink line that always crosses the second line while doing the home pregnancy test. How will you know that the HCG hormone is high in your blood? You are doing a home pregnancy test before the time unafaa ukuwe unafanya the pregnancy test, but hii bado inatoka tu positive with a very strong line. Hiyo inaonyesha kwamba pregnancy hormones ziko juu, and most likely